Hi, everyone. This is Deborah Elmore, and I'm Executive Director of the Bay Area Association of Kidney Patients. Welcome today. We've got a great program coming up. First, I'd like to say a few housekeeping things. We can't see you and we can't hear you, but if you have questions, you can put them in the Q&A. The meeting will be recorded and posted on our website. And BAAKP, Bay Area Association of Kidney Patients, is a nonprofit whose mission is to educate and support kidney patients. So with that, I'm going to turn it over to Ward Kostrom, who is our program manager. Ward?
Good afternoon, everyone. Welcome to the webinar. We have Toni Rodolfo-Benson to speak to us today. She is a certified grief educator with a multifaceted background. She is a registered nurse and also a life and career coach, but she spent 6 years as a clinical trial consultant in biotech and another 6 years directing clinical operations for cancer treatment. As part of helping her mother with her dialysis treatment, she became a board member of the BAAKP and left the board a couple of years ago when she suffered a shattering loss when her mother passed away. And getting over that grief led her to a new career as a certified grief educator. And she's going to talk to us today about grief in the context of chronic kidney disease. Toni?
Great. Thank you, Ward. Thank you so much for that presentation. Let me just share my slides with everyone. You're going to see my screen for a second here. All right, can everybody see my slides? Wonderful.
Yes.
Well, welcome everyone to this webinar, and we're going to talk about titled The Beacons of Hope. Thank you, Deborah, for this title, where we're going to talk about kidney disease, grief, joy, and healing. Just quick little housekeeping here. Just when we're talking assume positive intentions, openly, we're not going to be able to share experiences here, but at the same time, it's okay to sit in discomfort, especially when hearing new information. And just a brief mention that I'm going to be making some jokes, and these jokes are to make things light and not to make fun of anyone or anything. This is just to really make light of what we're talking about, because I know sometimes grief can be pretty heavy. And we'll take some breaks. Just a brief intro. This is my mom. This is when we were with the Bay Area Association of Kidney Patients. We attended support groups. We met all the board of directors, and in turn, after attending so many support group meetings, I decided to be a member of the board as well to give back to BAAKP, as it has been such a wonderful organization that really truly helped me and my mom during the time that we needed it the most. We were close to transplant when she was diagnosed with early stage lung cancer. Unfortunately, we didn't get to do that transplant, but our story still lives there on the website of BAAKP. And just a quick quote here by Lord Byron: always laugh when you can. It is cheap medicine. So we're going to do a bit of a jokes here, and I wanted to start with this question here. If you know, what is the coldest city in the world? And the answer is Berlin. All right, one more. What do you call a celebrity who's also a baker? And the answer is a starving artist. All right, I'll stop with the corny jokes now. So we're going to understand at the end of this session. My goal is for everyone to understand what grief is. And I know a lot of people think that grief is just loss. It's not just loss. It's a loss or death of a loved one. But most often it's also associated with a major life transition, such as a breakup or a job loss or chronic illness. So there's definitely a lot of losses. I know earlier when I was talking to somebody, they mentioned something loss about a loss of a pet. So anything that really is that matters to you, whether it's a life, a job, or a loved one. Many are aware of the 5 stages of grief. If you're familiar with Elizabeth Kubler-Ross, she is a Swiss-American psychiatrist that studied that wrote a lot of books about grief and dying, and she created these 5 stages of grief, which has become the gold standard for a lot of people. It's denial, anger, bargaining, depression, acceptance, and that has held true for a long time. But then we soon realized that grief is not linear. It's not a straight line. It's not just all these stages and then you're done, your acceptance. But there's actually, it's kind of messy. I always think about it almost like a spaghetti where there's anger, there's confusion, guilt, depression, isolation, but there's also some hope and joy. So it's all these encompassing things. There's no single way, or there's no right or wrong way of grieving, and any type of feelings can show up at any time. And grief can come in waves. Sometimes it's very strong and that you're always crying, and that sometimes it's really, like it's not there. And so it can come at any time. There may be at trigger points where it's that you hear a sound, or there's some kind of scent or food that you see. And the real thing here is grief becomes a part of you, whether it's people that disappeared in your life, and it just becomes a part of you. And grief and joy can actually coincide together. We're going to talk about the types of grief, and there are many types of grief, and maybe some of these will be relating to you or not. There is what we call the normal grief. It's the usual response to a loss with emotions that usually sometimes shifts over time. And then there's what we call the anticipatory grief. This is the grief that happens before a loss actually occurs. It could be when somebody has a terminal illness, like advanced dementia, or nearing the end of life. You're already anticipating the loss of that person. There is a complicated or prolonged grief. Complicated grief or prolonged grief are kind of similar. My slides, there you go. And they're extremely intense for much longer, and sometimes it gets in the way of your living. You get trouble getting out of bed, working, eating, sleeping, and a lot of times it lasts for a little longer, they said 6 to 12 months, it could be longer. There's also what we call the disenfranchised grief that is not recognized, but others may act that, the loss didn't matter. And sometimes people may make you feel that way. It could be, sometimes mourning a pet that other people may not understand, or a miscarriage, or a relationship that is not widely accepted. There's also what we call the ambiguous grief. Is a grief that's when someone is still alive but has changed so much that you feel like you've lost them. In plain terms, you're mourning a person who is physically there, but emotionally, mentally, relationally, they're not. It's almost like when there's somebody is going through like Alzheimer's disease or severe mental illness. There's also the traumatic grief. Grief combined with trauma, often after sudden or violent shocking loss. Collective grief shared by a group or community or society. Sometimes it happens in a large scale, like there's mass shooting, or there's a natural disaster. There's also the absent grief, and sometimes people don't feel like they're grieving, and it's actually okay if they feel that way. Sometimes the sadness is not there. Maybe they're in shock, and someone that died or something important was lost, but you just feel numb, and at that point you just feel that you got to give yourself some grace. And then there's the secondary grief, and this is the sadness or loss that you feel for all the changes that happen after a major loss, such as if there's a divorce and you lose the custody of the children or the house and all those things that happens afterwards. So these are just some of the types of grief that are commonly named. And I know that people, there can be other labels out there, but you may be able to relate to some of this. And we're going to talk about grief in kidney disease. It's very important to name this, as one of them is the shock of the diagnosis. And sometimes it is the life that you have, that the life that you expect. There's this loss of spontaneity because life starts revolving around appointments, labs, diet fluid limits, and treatment schedules. There can also be some anger and frustration about why me? Sometimes you're feeling betrayed by the body, blaming for past mistakes and thinking you did something to cause this. There's also grieving of the identity changes, such as you're no longer feeling like the same parent, the same worker or spouse, or independent person that you used to be. There's also financial strain. Sometimes with missed work, the pressure, the illness placed on the whole family. Grieving when others do not understand the emotional burden, which can make the patient feel alone or unseen. Others like physical appearance, feeling alone. In case of my mom, when she was going through the dialysis, she always took pride of her physical appearance. And there was a point when her skin was crinkling because of the peritoneal dialysis it's caused by that treatment. And I can tell that it was taking a toll on her because she started wearing long sleeve shirts even when it's really warm outside. And at nighttime, she's hooked to the machine and she's not able to go to the kitchen as much as she wants to because her bedroom is far from the kitchen. So there's just so things that sometimes affect the grieving process when you're not able to do the things that you do. And this is one thing we want to make sure that, to know that you're not alone. And I'm sure you probably know that, but there's 35.5 to 37 million people in the US are estimated to have chronic kidney disease in the US alone, which is more than 1 in 7 of people of American adults have kidney disease. And it is also the 10th most common cause of death in women and 8th in men and 8th for women. About 815,000 Americans are currently living with kidney failure, and about 555,000 Americans are currently on dialysis. So this is a lot of numbers, and we know that this is something that we're currently dealing in our health system. Okay, I know that was a lot, and I went through it quickly because I really want to focus more on what are the things that you can do and what are the things that will help you. But meanwhile, we're going to pause. I'm going to put some joke here again. And my question is, why did the 85-year-old get a new computer? Because they wanted to find their soulmate in the cloud. Okay, I'll do one more. What do you get from a pampered cow? And the answer is a spoiled milk. I hope I'm getting some smiles out there, or frown is okay. All right, we're gonna go to the next phase of our webinar, which is we're gonna talk about grief coping strategies for patients. And this is where I wanted to spend a lot more time with you, because these are the things that really matters when we're dealing with kidney disease. First is allow yourself to grieve. Feel whatever you're feeling, such as sadness, denial, resentment, but without judging or blaming yourself. Find routines that work. Create new daily routines that help you feel less overwhelmed. You may not jump back into an old life immediately. You can keep doing things unrelated to kidney disease, like if you have some jobs or old hobbies that you do, and any family role that you've done in the past. You can take back some control and focus on what you can do, not what you can't. Like, I know there's some diet restrictions. You can still eat the things that you like, maybe not as much as you want to in the past, or you can pick a different alternative to what you're used to. Take your medications as prescribed, and you can't change diagnosis, but you can feel your best. Treat yourself. Spend time with loved ones, go for a walk, enjoy the sun, go out, maybe watch your favorite movie, practice self-care, maintain hobbies. Like I said, humor is the best medicine. Maybe watch some really funny movies out there, funny series, and continue some personal interest. Maybe it's knitting or writing that you haven't done in a while. There are so many other alternatives. Reach out for help. Talk to loved ones, friends. Let them know what you need and talk to someone trustworthy that can help you. Support groups are really good as well. So talk to somebody, maybe your physician or your nurses can recommend something for you. In our digital age, there's so many things that you can find nowadays. Next is seek professional help. If grief interferes with your quality of life, can seek therapy, counseling, or support. This really is helpful. I know that sometimes there is still stigma about getting therapy, but as much as we're getting physical help for our physical ailments, it's also so important to get some help when we have some mental challenges or emotional challenges. And therapy are so much accessible now, especially with a lot of online help. There's BetterHelp and Spring Health, all these other websites that offer counseling and therapy. Communicate openly with your care team. Tell your doctor if you're feeling depressed or anxious. This may be symptoms of what's going on in your body, and a lot of times medications can help with that as well. And ask for referrals if you need to. There are psychologists or social workers who specialize in chronic illness. Join support groups like this one, Bay Area Association of Kidney Patients. I tell you that this is the best thing that my mom and I did when we were going through her kidney disease, because it was a monthly meeting that we really looked forward to, and we attended religiously because we always learn something. And also, you don't feel alone, and the community just helps out a lot, and they do such a great job. Connect with other communities as well. There are other support groups as well, and there are other communities that you can ask your doctor, your nurses as to other groups that they may recommend. And also, sharing stories can reduce isolation. When you're able to share your story, sometimes some people just like, oh yeah, I feel the same way, or I've done that too. That happened to me as well. And you feel less alone. And a lot of times you learn so many things that you can do yourself. Stay informed. Read about your condition. Ask questions. Again, with our digital age, I know it's hard to just believe everything out there, but at the same time, when you read more, you know about your labs, you know about your appointments, you know more about when you talk to your doctor and your nurses. And I know I keep plugging BAAKP because when we were attending BAAKP, they were really giving us a lot of helpful information, and I learned from everybody else. So knowledge is power, right? So get to know, read some books about your condition, read about what you're going through. There's also a podcast, and we'll talk about that later. And then be patient, kind, and compassionate with yourself. The word getting over it when it comes to loss is not something that is accepted. It's like you don't get over something, but you can find better ways to navigate life. You can celebrate small victories, like sticking to fluid restriction for a week, or having a good laugh in all of those small moments and enjoy them. Find what can give meaning to you and what gives you joy. Keeping engaging in activities that bring joy and meaning, considering some work like legacy work, if you've done journaling, writing, art, and all of those things, reflect on what still matters to you and what gives purpose. Before the end of this session, we're going to do some journaling later. I'll give some time, and we'll talk about how journaling can be such a powerful tool for you. And acknowledge loss, grief, and frustration as necessary. Don't let those feelings monopolize your thoughts. By combining medical adherence, emotional support, and positive coping skills, you can live the best life possible. As much as we give coping strategies for patients, we also want to take care of the caregivers. The caregivers can also suffer burnouts, and we want to make sure that caregivers are acknowledging their feelings. I know caregiving is a tough job, and my mom used to be a caregiver for my grandmother as well. And so I know the toll that it took her. So we want to make sure that caregivers are also taken care of. Recognize your limits of endurance and strength. That means know when to get help, because I know that sometimes it can be impactful. And there are help out there. Reach out to social workers, to your dialysis centers, to your doctor to see what kind of support you can get so that you can get help. Take time away from caregiving for your own health, spirit, and relationships. Sometimes you do need to take a break as well. I know, especially for caregivers who are, caregiving for 24 hours, 7 days a week, and it can definitely give a toll. Take some time off, take a day off, maybe arrange somebody to take care of your loved one while, you take a day off to go to a movie or just to go for a walk. And then take pride in your accomplishments. I know sometimes it's hard when you're tired and bogged down, but take pride in your what you do, because you're doing a lot. And I always say this: taking care of yourself is not selfish. Sometimes people think that, oh, I can't do something because I'm focused on the person I'm caring for. But you also have to take care of yourself. It's when you actually take care of yourself that you're able to give more. Because if you don't take care of yourself, there's definitely the build up of that stress level there, and burnout can happen. So it's very, very helpful to be able to take care of yourself. You can only help your loved one if you take care of yourself. There's always that analogy that people always say, when in an airplane, when the gas masks fall out of the bin or the container up on top, you put your mask first so that you can breathe. It's almost similar to caregiving. Again, practicing self-compassion and being kind to yourself, that you're doing a lot. You're doing a lot of things for your loved one, and sometimes you make mistakes, sometimes you feel tired or burnout, and that's all normal for caregiving. And you just have to, you have to practice self-compassion and self-care. I know I keep saying something about laughter is humor, and I think because just when you watch all these movies that are scary or tense, it actually even increases your heart rate, and it's not very restful. But when you watch something light and funny, it actually helps with your endorphins, and it's helps with your mind, your body. And again, laughter is the medicine. Okay, journaling. So I talked about earlier about journaling, how you can just grab, I know each one of you, we did ask to prepare a notebook and a pen. So if you have it with you and if you need time to get it, just grab a piece of paper and a pen if you have it ready for you. Journaling has been proven in research that it is very helpful. And for some people, I know I used to be very resistant with journaling as well, but because I'm so bad with like doing reflection type of journaling. But you can do that if you are used to doing reflection type of journaling. But there's also the type of journaling where you can just make a list. And some of the things that we can do today is just writing prompts. So I'm going to prompt you some of these things, and you can write on your notebook the things that didn't come to your mind, and I'll give you a few minutes to do that. So one prompt that we can start with is today I feel. And you can just write whatever it is that follows that. Today I feel whatever it is you're feeling. And the reason for that is just acknowledging what you're feeling, recognizing it. It's when you recognize that feeling that you actually learn, you kind of, it's right there in your face that you're identifying it. And when you're able to identify it, you're able to do something about it. So go ahead and take a few minutes. And then the other next one is today I am grateful for. There's been research that says gratitude writing is so powerful in helping you think about the things that you're grateful for instead of thinking of things that are negative. And it's when you're thinking about what you're grateful for that actually helps you inside your feelings as to like, oh yeah, I can still do this. Oh yeah, I still have this. So think about the things that you're grateful for, whether it's your pet, your family, your home, your friends, whatever it is, and anything that you're currently doing, anything that you're grateful for. And then the next one is something I miss doing that I can still do. I know with kidney disease, there are a lot of restrictions, but at the same time, there are still things that you can do. And when you think about them, sometimes we don't, when we're not prompted to think about them, we don't think about them, like out of sight, out of mind, right? And so journaling is kind of the point of it where you write these things down, and today, maybe later today or tomorrow, you open your notebook, you open your pad and just saw these prompts and think, oh yeah, I can add more to this list. This is what I remember that I can still do. These are the things that I am grateful for. And today, this is how I feel. Yesterday, I was sad. Today, I'm joyful. Or today, I'm thankful. And then the other prompt here is things I still hope for even while living with kidney disease include. And if you don't write the questions or you miss the questions, we'll have the recording again and you'll be able to continue to write prompts for this as well. But if you can write them down, that would be great. And then the last one is in the middle of all this loss, one thing that still brings me a moment of peace is. So this is a hobby that you can start now, and you can also, I recommend leaving your your journal where you can always see it, where it's in your kitchen counter or your bedside or your favorite table in the house, wherever it is, you can put your journal there and you continue to write prompts. And sometimes you may come up with other prompts that you can think of, and you can start journaling using those prompts as well. Okay. The essence of time, I'm gonna move forward with the next slide. I also recommend starting a safe space sanctuary in your home, like keeping it clutter-free as much as you can, and filled only with items that brings you comfort. I know sometimes when I know myself, when my environment is so cluttered that I can't think, or I feel like, not as conducive to things that I want to do. But when your environment is clutter free, it feels open, it feels warm, it feels cozy. And then adding some soft lighting, some cozy textures or pleasant scents, like if you like lavender or vanilla or lemon, or any soothing scents that you can have. Soothing sounds. This becomes your nervous system kind of regulation spot, especially helpful given when you're when you're feeling a little stressed or not in a good space. Sometimes this soft lighting, warm environment can help with the healing. Bring in some joy creating elements. Maybe they're flowers, plants, books, art, maybe your grandchildren's art or pictures of your family and friends, whatever it is. Put them in places when you can easily see them, that brings joy to you and that will bring kind of some warm feeling. Some people, repainting walls is available, and so if you're able to do that, sometimes if your walls are dark and dingy, repainting them with something soothing like yellow or a light, colored blue or green, something that kind of gives, an enhanced look, but at the same time, it also changes what it was before, and it kind of opens up the realm or the space that you especially the space that you spend the most time with. And then opening windows and curtains, so simple. If it's something that that you like, allowing the light to come in so that there's light, there's sun coming through, that helps as well. I'm gonna talk about artificial intelligence just really briefly, because I know this is a very sticky topic and a lot of people are pro it or against it. But all I can say is that there's a lot of really good information out there now. And I know that when AI is used in a good way, that you can actually get a lot of good information. But you also have to be very careful with the information that you get. Make sure you check with your doctor, with your nurses, and just make sure that it's in a credible source as well, like NIH, CDC, and all that, American Psychological Association, those kind of credible sources. So just be very careful with AI. And sometimes, depending on what you ask, you want to make sure that, it's not asking you to do some things that are not healthy. So again, always check with your doctor, always check with your nurses. As I said earlier, humor is the best medicine. So here we go. Hear another one we have. And this might be the last one. So I promise, I think this is the last one. So what is a marsupial's favorite drink? I know Ward guessed this earlier. All right. It's a Coca-Cola. Okay, I'm sorry. Even me mix things. Okay, it's so corny. All right. To have a final message. Acknowledging loss and grief and frustration is necessary. But don't let those feelings monopolize your thoughts, your days, your life. By combining, adherence to your doctor, what your doctor is telling you, bringing control back to yourself, emotional support, lifestyle changes, and positive coping skills that we talk about today, you can live your best life. And those things that we talked about today are not just all it. Those are just examples, and you will find that you will find other things that you still love to do that still give meaning to your life and gives meaning to you, that you can share with friends and your family. And just want to leave this quote by Dr. Mark Hyman that the power of community to create health is far greater than any physician, clinic, or hospital. Again, find your community, use your resources, because those are all very important. And I want to provide some resources here. These are just some podcasts that when I looked at what are the best podcasts out there for grief, but there's also a website. It's called thegrief.com. There's a lot of information there that you can look. And the podcast, the number one here that I listened to, especially after I lost my mom, is All There Is. It's so powerful. I feel like I'm not alone in this grief, because they all talked about, Anderson Cooper bring in guests, and you would think that some of these celebrities, they went through so many things as well. And, you can relate to some of the losses. And there's also all these other podcasts. Feel free to check them out. Deborah will send them to you later today so that you have all this information. And then there's also books. These are just some of the books that I can think of. I know there's so many grief books out there. So, you can go to Amazon or to Google or to Half Price Books, or you can also go to Audible if you listen to Audible books. And there's a lot of books that these are just some of them, like The Year of Magical Thinking by Joan Didion, The Grief Collective by Marian Trent, and these are just some of the grief books. Finding Meaning, the number 7 by David Kessler. I read that I think 5 times. Nothing to Fear by Julie McFadden. She's an RN, and she provided a lot of really great information because she worked in the hospice. She talked about, caring for patients and how to talk to doctors and things like that. So one of them highly recommended there is Nothing to Fear. But feel free to check out all the other. These are just some of the books, like I said, I've read. And I guess that was it. I'm sorry, I went through all the everything so quickly, but that also means that we can have more time for questions, which is great if there are any questions. And if you want to give me some feedback, feel free to scan this code, and Deborah will also send this information to you if you need to. I always like to hear feedback, whether it's good and any rooms for improvement. And that's it. Thank you so much. And Deborah, I think we can start now with the question and answer.
I had a question, which was, how can caregivers give support to kidney patients? What can they do?
There's a lot of support that caregivers can do, such as getting a lot of knowledge themselves, getting to know what is it that the patient, the person that they're giving care for needs. It's definitely, we want to make sure that they're aware of what are the fluid restrictions, for example, what kind of diet the caregiver or the patient is on. Their appointments. Sometimes it just depends on what the patient needs and how they can support them, getting them to their appointments on time and making sure they're keeping track of those appointments, because I know sometimes there's quite a bit. Getting to and from dialysis centers. The important thing is the communication between the patient and the caregiver to make sure that they know what the doctor's orders are and what are the treatment plans. And around the home, the caregiver can also help tidy up the space for the patient, because sometimes the patients don't have a lot of energy to clean, to tidy up the place, to organize. And if the caregiver can also help in that way, that can help as well. The caregiver can be a really great companion when suggesting movies or
Yeah.
suggesting books and all of that. Conversation, maybe researching some information about communities that they can get involved with.
Thank you.
I hope that answered that question.
You did. I'm going to tell the participants that if they raise their hand, I can unmute you individually. So if you have questions, feel free to raise your hand using Zoom.
Let me start while people are gathering their thoughts. I wanted to thank you, Tony, very much for a very thought-provoking presentation. I just had a flood of ideas going through my head the whole time you were talking. And to start with, sort of at the start, to begin my questions with the end, you talked a little bit about AI
Mhm,
and the need to make sure it knows what it's talking about.
mhm,
My wife asked AI a couple of days ago for the basis for some advice that it gave her, and the AI responded that with an apology because it had been hallucinating.
Oh,
But my question is, what kind of questions and prompts would a kidney patient who's suffering from grief um, think about asking to addressing to AI?
I would say, when it comes to grief, I would say just maybe resources. You can ask for, like, oh, what's the really good books out there or podcasts out there? I would keep it limited to things that you can, like tools that you can use for grief. I wouldn't use that as kind of like prompting questions into as, why am I feeling this way? Because they're not therapists. And when it comes to emotions, when it comes to mental, when it comes to doctor's advice, I know we Google things anyway, right? We always Google, like, why is my elbow swollen? But at the same time, again, I would always, when it comes to anything medical related, I would talk to my doctor or the nurses at the dialysis center. I would not consult AI. You may ask it, but don't use that info. Nobody can stop you from asking all those questions. But at the same time, I would caution it because sometimes you would go into a spiral of, it's like, oh my gosh, what is this? Let me just give an example. I gave my dog grapes, and I didn't realize at that time grapes is so is very toxic to dogs. I Googled and AI'd, oh my gosh, I gave grapes to my dog. And it says, your dog's gonna die. Your dog, take him to the emergency. And I thought, and so I was really stressed. But then when I called the vet, they're like, oh, what's the weight of your dog? I said, 60 pounds. She's gonna be fine. You just gave one grape. She's gonna be fine. But all the resources that I saw, everything that I checked, it says take him to the emergency. And then they're gonna give them. They said that they're gonna give the dog something to induce vomiting. And I'm glad I didn't do that because the poor dog would have been just traumatized. So, as a caution, just be very careful with what you ask. If it's something health related, then ask your doctor, go to your nurses. But if it comes to, it's like, oh, what books, what podcasts, where's the nearest park I can walk to? Those are okay.
Iris?
Yes, can you hear me?
yes.
Yes.
Okay, thank you all so much for doing this today.
Well, hi, Iris. It's been a
Hi,
while.
I know, and I'm so thankful that you're doing this. I, I, I've been told to, or shared, encouraged to journal. Today, I started journaling while you were talking, and I thank you for that.
Oh, you're welcome.
And this is perfect. And I'm going to share it with other people that I know who are grieving. But then when you talked about grieving, there are different, like right now, I've had my 11-year anniversary. And I sent Deborah a picture that my sister made for me that I really didn't, I didn't seem real happy just to myself about it. But after listening to you, I got chills because I said, this is a way for me to celebrate. Rather, I'm very positive, and I talk with people, anybody, about kidneys and that type of thing. But like you said, I don't consider myself as much as I do others as far as lifting up and encouraging. And that's I think this I'm hoping you can do this more, because it is fantastic to hear, like you said, other people who understand how you feel. And then one other thing I want to share with people who are grieving for whatever reason. I shared with a family member the other day how I was really, really feeling, and how I thought that I was being lazy, but I wasn't. I was ill. And so she was shocked, because I'm usually the caregiver. So I want to say to caregivers, allow people who are grieving, are sad, to say exactly how they feel, because that was a release for me, to be able to say, you know what, I don't know if I'm just being lazy, or or am I? Is there really something wrong with me? So allow people to be honest with you, and not think that, like what my family members said, oh, you shouldn't say that. Don't think like that. Well, that's how I'm feeling. So let that person share with you how they really feel.
Right.
Thank you so
Right.
much.
Oh, you're welcome. And that's so true. I know, I feel like our society is so grief illiterate. That's why I am speaking about grief. And when I experienced my grief, intense grief, especially when my mom first just passed away, and it was just, people would be like, oh, at least she's no longer suffering. That is true, but at the same time, it's not helpful comment. Oh, at least, and there's always advice. And sometimes you don't need advice. Sometimes you just need to sit with that person, and sometimes maybe just a hug and just to listen. And sometimes advice is not always, the best. And so being with that person, and instead of making something comment that is not helpful. And also, don't disappear, because especially when your loved one, lost someone, it's the best thing is to be there for them. And sometimes some people don't know how to be around people with, that are grieving. And you just have to give them some compassion, because maybe they don't know any better. And not because they're mean people or they're bad people, it's just that they don't know any better. And so if people starts, just kind of moving away or not saying anything, that's just because they don't know how to process the grief of others, and they don't know how to deal with it.
Jane?
Jane?
Oh, Jane, you're muted on your side.
I'm gonna go ahead and stop sharing. Maybe we can.
Am I unmuted?
You're unmuted.
Yeah.
Okay. Then you didn't hear me cuss. Okay. Thank you for doing this. I really, have always felt that there's a lack of support for kidney disease patients. Like, I could use a once a week grief group, or I guess even a once a month, but our group isn't really a grief group per se. It's not labeled that. And I feel grief over my loss. Of kidney disease, of having it. I have to go to the clinic 4 days a week now, and it's really hard. And I never talk about it. When my friends or my caretaker, I tell them I don't need help and I can do it all on my own. But I know that there's no place to really go with my grief.
Yeah. Jane, if you go to thegrief.com, you'll see that there are a lot of resources out there. And I know that there's a lot of, what do you call this, grief circles going on. I actually, I live in the Tri Valley in Dublin, and we do grief circles once every month in Livermore. And that's kind of like just in that area. But I know that there are other places. If you go to Eventbrite, sometimes you see a lot, and you type in grief, you'll see some group support groups that kind of meets locally. Meetups is another one. You just have to look for certain groups in your area. Where do you live, Jane?
Albany.
Albany. Yeah. See,
Does it does it
yeah. Mhm.
does it matter if they're all of, they're not going to be, then it's not going to be people with kidney disease at meetings like that. It's kind of rare.
Yeah. Yeah. Um, it may not be just it. Yeah, I don't know if there's some kidney disease per se group that will talk about grief, but at the same time,
Uh,
this is. I mean, the kidney support group is. I know it's not solely for grief, but at the same time, it's definitely the support group. That's what this is for, is to talk about at the same time, not just the physical aspect of grieving, right, Ward? It's also helping people get through the strains of
Well,
being
the
in
shock and trauma,
dialysis.
the
Right.
shock and the trauma,
Exactly.
the
Yeah.
what? The shock
the
and the
shock
trauma?
and the trauma
Yeah.
and the ongoing shame and
Yeah. Yeah.
difficulties.
Right. It's not just we just don't talk about the labs
At
and
our group
yeah.
here?
Yeah. And Deborah, maybe you can say something more about the support group, not just dealing with, talking about.
Yes.
Yeah.
We have our support group meets once a month. I know you've attended before, Jane. Uh, we're
Mm.
going to be meeting at the end of this month will be our next one. And I think that would be a great topic to bring up
Okay.
because other people feel the same way you do.
Uh-huh.
And it would help just to know that you're not alone in how you're feeling and
Yeah.
talk to people that understand.
I feel like the background is always be as healthy as you are, as you can be. And I usually can play that game. But lately, it's just been getting hard. And it's not really what's going on. I mean, I'm healthy that I can sit here and talk about it. I know that. But I guess it's complicated by family members and lack thereof. I don't want to complain. I don't want to mention it to family. They know what's going on. But this is going
Yeah,
to be
but
a really tough week. I've got dialysis in the center Monday, Tuesday. I have 2 heart procedures Wednesday, and I go to dialysis in the center Thursday, Friday. So it's a brutal week. And I don't know.
That is brutal.
I
Jane, how about if I give you a call after this?
okay,
I'm pretty sure I've got your phone number and we can talk.
And I'm
okay,
happy to talk to you too, Jane, and offline if that helps.
okay.
And Deborah
That'd be
can give you my
helpful.
contact
Okay,
information.
yeah, I will. Um, Estelle, hold on, let me allow you to talk. Thank you, Jane.
thank you, Jane.
Yeah.
Estelle, you're muted. Okay, now. Estelle? Estelle also put a question in the Q&A,
Mhm.
that she's had long-term depression and that some of the drugs harmed her
And
kidneys.
what is the question?
I'm not sure. Um, Estelle,
Are you able to tell us your question, Estelle?
I guess not.
If it's about depression, one thing I would really say is that talk to your doctor. That's really the best advice there because they can direct you to something. They can ask you more questions. They can find out what do you need when it comes to depression. I am not a psychologist, and so my go-to is always talk with your doctor, get some help. There's always help out there, and your doctor will be able to give you the right resources.
Another question from the group is, as much as caregivers support kidney family members, are there support groups for caregivers in the South Bay or Silicon Valley?
I don't know per se, but there is something that we can provide you. I'll take a look at support groups for caregivers in the South Bay.
I know there aren't that many caregiver support groups, but I think sometimes like Kaiser and
Mm-hmm.
some of the hospital systems have
Right.
caregiver support groups.
I think the Mayo Clinic does in
Yeah.
Phoenix.
So maybe, yeah, there's Zoom.
Yeah. And a lot of hospitals like Sutter, they have their social workers. And if you contact their social worker number, that they'll be able to help and give you maybe some helpful information about caregiver support.
Okay, I think that answers all the questions, Ward.
I
I'll
have
take a
one
look
more.
at
Yeah.
this and I'll send it to send to Deborah, and then maybe she can share it with everyone at the next support group.
Yep. Following up on what Jane said, I think my question is much less profound than hers, but as part of my treatment, I take daily walks and I take a nap every day because I'm always tired by this time of day.
Mhm.
Um, and I kind of worry that it puts it kind of it interrupts my family's plans and desires, and I get shame over that. Um, and I just tell myself, look, you need to do this for yourself. It's part of your treatment. Um, but still, I can't get rid of that feeling. Is there
Yeah,
anything I should do?
I always say self-compassion because you're going through a lot. And if your family is, very accepting and they're actually understanding of what you're going through, the more that you should give yourself the break because a lot of times we're harsher on ourselves, right? And we shame ourselves, we blame ourselves, and you're just doing the best that you can. And the fact that you're taking care of yourself as a kidney patient, your role is to take care of yourself first because of what you're going through, a lot of things already that you've gone through, and taking care of yourself is the number one priority. The fact that you're taking naps, Ward, that's a good job, and taking walks, you're doing the best that you can. And it doesn't
So,
help to feel shame or to blame yourself, and it doesn't help. And if you can communicate with your family about it and just talk up to them about it, and sometimes they're probably going to tell you like it's okay that you take a nap or you take care of yourself. And sometimes we're, like I said, sometimes we're harsher on ourselves.
so if it's as I think at least my daughter perceived it as being selfish.
Hmm.
But I guess what you're saying is it's socially responsible selfishness.
Hmm. Maybe she doesn't understand. Maybe it's you're able to communicate with her what's going on with your body, what's why you need those naps and why you need those walks. And sometimes we don't communicate the things that are going through with us with other family because of shame of being judged or the shame of, we're just, I don't know, we're maybe embarrassed or we don't want to burden them. That's a common thing. My mom used to do that. I don't want to burden other people. But communicating what you're going through with other people, especially the people that are closest to you, they should know what's going on with you. They should know that you need to take rests because instead of you forcing yourself to do something that your body is not allowing you to, they're not understanding. And so if you make them understand that this is what's happening with my body and this is why I needed the things that I need to do, then maybe they will understand. And unfortunately sometimes you do have to set up barriers for yourself to take care of yourself.
Thank you.
Just remember, they're not feeling what you're feeling. They don't know the journey that you're going through. You're the only one that knows your journey. You're the only one that's feeling that low energy. You're the one that's feeling that drain, the fatigue. They're not. So they're not completely, don't have the complete picture of what's going on with you. To your daughter, probably like, oh, it's the tough, strong dad that I always had and always had that energy, but they don't understand that no, dad now has low energy and needs to take a nap when he needs to.
Bertha?
Hi, Bertha.
Hey, Toni, it's so good to see you.
You too.
Your presentation was wonderful and it
Oh,
was
thank
very
you.
much needed. I want to share a resource. Someone at the meeting was talking about family, about caregiving and caregiving support. In San Francisco, there is an organization devoted solely to caregiving. It's called I'm not the best at posting things on in the chat. So what I will do is share it with Deborah, who could probably post it in the chat for us. The name of the agency is called Family Caregiver Alliance. And let me share it with Deborah. And it's located in San Francisco, like I said. And their phone number is area code 415-434 3388. And let's see, they do have a website. Um, what they do is just everything related to caregiving, from supporting the caregiver to helping families or sick individuals find caregivers. Um, I'm assuming an agency like this would have support groups for various caregivers. Um, they mention various diseases. Um, they help people with like someone dealing with Alzheimer's, stroke, Parkinson's, but I assume as well people dealing with end stage renal disease. Also caregivers for very elderly people. So, like I said, I'll share it with Deborah, and Deborah can post it.
Thanks, I will.
Right.
Thank you so much, Bertha, for that. And see, that's the power of community. Bertha was able to quickly get some information and share it with the group. And the same thing with each and everyone that's attending here, too. It's really great when you have resources that can help other people. Feel free to share it with the rest as well. Thank you, Bertha.
Estelle asked in the Q&A, how do I get a patient, I think she means caregiver, that has compassion for me? And it sounds like maybe the website that Bertha just said might be a place to start.
That may be a place to start. Yeah. And you can interview caregivers and test them out, and sometimes you don't know until the person is giving you care whether you like them or not, or they're a good fit. And if they're not a good fit, then ask for a replacement. That's one thing that we talked about when it comes to control, is that these are some things that you're able to control, who is able to, who matches the way that you want to be taken care of. I know sometimes we may have some people that get assigned to us that we don't like, but your voice matters. And if you don't feel that that caregiver is the right fit for you, then you can contact the agency and have them send a replacement.
Ward, anything else?
No, I think we've covered my questions, and those of several other people.
Toni, this has been so interesting and educational and inspiring. So we really thank you for coming and speaking to us today. And
You're welcome.
I haven't talked to you about this. I thought about it during that maybe sometime we can do a session that's not recorded and where people can see, so that you can see people laugh
Yeah.
at your jokes and know how long to leave for journaling.
Okay.
So
I would love that. That would be
yeah,
great.
I think that would be a good thing to do, because we can tell from the questions that people
Mhm.
are involved and have a lot of questions.
Yeah,
So
that sounds
thank
good.
you very much. Thank you, Ward, for putting this together.
Thank you.
And thank you, everyone, for attending today. The video will be posted on our website um, in the next couple of days. And I will be posting Toni's slides also. So have a good night, everybody, and thank you again. Thanks,
Thanks,
Ward. Thanks,
Thanks
everyone.
again,
Toni.
Toni.
Thanks, Ward. Thanks, Deborah. Thanks, everyone.
Bye-bye.
Bye.